Hello everybody, Dr. Shadi, Ireifej here, board certified surgeon, chief of specialty, part owner of TrueCare for Pets, Studio City, Los Angeles, California. We are a 24/7 emergency specialty hospital here for all of your dog and cat needs. We offer surgery and internal medicine as well as emergency. Feel free to come by anytime. We'll be happy to take care of you. This podcast episode today, we'll be talking about the dreaded vaccinations. Obviously, currently a controversial topic in people. Not sure why, but it is. And there are plenty of videos now online that you can look at. It talks about the science behind vaccinations in people and why it's not so smart to not get your kids vaccinated. We're going to focus on the animal side of things, of course, and we'll touch base on a couple of topics. First, we'll talk about what vaccinations are used for and what the core versus non-core vaccinations are. And then we'll talk about situations where pets that have vaccination reactions, what you can do as a veterinarian or as an informed client to try and minimize reactions. And then thirdly, we'll talk about scenarios where you don't want to vaccinate your pet and what you can do to consider other options. So first, let's talk about what vaccinations do. They are intended to stimulate the immune system. So basically, there's different types of vaccinations. They have usually some component of the infectious organism in them, and then usually they're bound to some kind of carrier molecule to help the vaccination get into the body and stimulate an immune response. The idea is that once the immune system is identifying that organism, it will then be better suited to fight that organism if an infection ever occurs in real life. And so that way the antibodies are already formed so the patient, the dog or cat, can then fight an infection later on. And these vaccinations are all against viral organisms. Yes, right? Viral. They're all viral. There's now there's vaccinations against cancer, but that's a different topic altogether.
Well,
but I don't know if
there's against like Giardia, which is a protozoa. They're not all viral, no.
Okay.
But all the core ones are viral.
All the core ones. Yeah. So vaccinations are on the whole excellent, and a lot of them are very close to 100% preventative. I mean, the parvo vaccination and rabies are very, very efficacious, and so a lot of the vaccines we give pets are really efficacious and for very little risk. So I hope that helps with the understanding as far as the immunological reasons why we give vaccinations. So when you go see your veterinarian with a new puppy or kitten, they're going to talk about boostering your pet. And there's a very specific schedule that we try to follow with vaccinations in these young animals when you first acquire them as pets. If you're looking for kind of a more formal consensus on vaccinations, the internal medicine specialists, if you look online for their yearly consensus, I think every once in a while they update the vaccination protocols in their consensus. So ACVIM, American College of Internal Veterinary Medicine.
With vaccine protocols, it's the AHA that makes the actual vaccine protocol recommendations. Maybe it's based off the ACVIM recommendations.
Yeah.
But general practitioners will follow AHA recommendations for vaccines.
Great. Yeah. So check out AHA, AAHA, and check out the ACVIM consensus. And if you want sort of more medically inclined literature on what the consensus is, because every year, every few years, it changes.
Yeah, and I see clients that think, what my vet's recommending is excessive. And, sometimes it is. They may be following a protocol that was
maybe outdated.
Yeah, and they just, that's what they've seen work, and so they're stuck with it, but it may not follow current recommendations. So if you feel like what's being recommended may not be right, you can totally look that up online.
Great. So let's talk about then how the immune system works in relation to puppies and kittens and why we boost them the way that we do. If you want to dive into that, Lindsay, go for it.
So puppies and kittens are obviously born with a certain amount of immunity to a lot of these common diseases that we vaccinate for from the mother. So the vaccine protocols are made based on those recommendations and veterinarians' understanding of the immune system through years and years of research, boring stuff that none of us have any interest in, but we know what the outcome was. So we know that puppies and kittens, natural or innate immunity starts to drop off around 6 weeks old. So that's why we recommend starting vaccines at that age, and why we do not count vaccines given prior to that age by usually breeders, because they're ineffective. The immune system's already doing its own thing. It's not going to respond to that vaccine. So if you've gone to a vet and had a previous vaccine that vet didn't count, that's why. And then we usually booster vaccines about every 3 to 4 weeks for a total of 3 sets, depending on cat or dog and how old you start the sets and whatever, up into about 4 months old or 16 weeks of age. And that's the point at which they all get usually their rabies vaccine. Sooner than that is not accepted by law. Later than that, they'll accept, but we won't vaccinate for rabies before 16 weeks.
Let's talk about the types of vaccines that are out there and which ones are essential, which ones are maybe less essential. Lindsay and Jae here. Lindsay and Jae joining us.
Hi. We've been here. He just forgot that. So core versus non-core, or essential versus optional, I guess you would say.
Yeah.
So your required vaccines are going to be your DHPPV, which stands for distemper, hepatitis, parvo, parainfluenza vaccine for dogs, as well as rabies. For cats, your required vaccines are going to be your FERCP, which is your feline rhinotracheotis colici panleukopenia vaccine. I deserve an award for remembering that.
Nice. Well done.
Along with your rabies. So for dogs, your optional vaccines, although some of these are very highly recommended and not really considered that optional, are going to be things like Bordetella, which people know as the kennel cough vaccine. Leptospirosis, depending on your pet's activity. If it goes hiking, where there's standing water, where there's access to wildlife, if you have raccoons in your backyard, stuff like that. Rattlesnake, which I think is a great one if you take your pets hiking in areas where there are rattlesnakes or you have them around your house. What other ones, Jay? Oh, and most recently, we've seen the influenza vaccine. We had some pets come over from overseas, and we saw a large outbreak of canine flu. So a lot of places are requiring the influenza vaccine for dogs in order to do things like boarding, grooming, that kind of stuff. So
and then on the East Coast, we have Lyme vaccine.
Yeah, we don't do that so much here. But yeah, it's still available if you know you're going somewhere that you need it or whatever. For cats, your optional vaccines are going to be your feline leukemia vaccine or your FELV vaccine, depending on, again, your pet's lifestyle. If it's indoor, outdoor, or has any chance of getting outside, you might want to consider that one. We've stopped doing the FIP vaccine a long time ago, so if the vet recommends that, I would steer away from it.
And that's feline infectious peritonitis.
Yes. Sorry for another abbreviation.
All good.
But those are your main vaccines that you're going to hear about. There are some other offshoots. There's cancer vaccines, melanoma vaccines. They're coming out with an osteosarcoma vaccine. There's also a Giardia vaccine, which I've seen used in pets with chronic Giardia that they can't get rid of with normal medications, things like that.
Mm-hmm. Yep, and so some of these vaccines are really important because we see them here, animals that are sick. So in dogs, parvo vaccine, the parvovirus, which causes a severe gastroenteritis, colitis, and dogs can get very sick and they can die from it. That's a vaccination that it's almost 100% preventative if you can get it. And then that's the parvoviral vaccine, or parvovirus, or short for parvo. And then the other one is rabies, because legally we're required to have rabies vaccinations. And of course, it's also one of those vaccinations where it's very, very efficacious, and the death rate is 100% if your dog acquires rabies from a rabid animal. So those are two vaccines that we really want to stress. We don't see distemper too often in America. It seems to be through herd immunity. We don't see it much, but if you go online, look at videos, there's plenty of countries that distemper not only is pretty prevalent to dogs, but actually large cats, apparently, like lions, can get it. And it's really bad.
I've seen outbreaks of distemper here
in
the States. Usually in like shelter systems or rescue groups, they somehow acquire one dog that has it, and then it just
goes wild.
Ravages, yeah. It's really big in Asia too, with dogs that have distemper.
And the Bordetella vaccination, kennel cough is kind of more of an annoying disease than anything else, although it can lead to secondary pneumonia or bronchopneumonia. But a lot of places that do either dog spas or dog boarding, physical therapy, they're going to want to make sure your dog has Bordetella vaccine, because the infectious organism Bordetella, organism is very, very contagious. And although it's mostly a younger dog thing, a dog of any age can get kennel cough, and it'll spread really quickly. So that's another one that's for certain circumstances you're going to want to consider.
And that's going to be the difference between your core, your required, and your non-core, is a deadly disease that's 100% preventable with the vaccine versus a disease that will cost you money. Your pet may get really sick from it, but is less likely to pass away. Those make those vaccines optional.
Mm-hmm. Yep. And so then that covers what vaccinations do and the types that are out there. Now, there are some pets out there, especially the tinier dogs, that can't handle too many vaccines at one time. And so you end up going to the vet for your first time with your new dog. It's a tiny dog, and you end up getting 3 or 4 or 5 vaccines, whatever the veterinarian recommends. And they end up with an allergic reaction from the vaccine. They're vomiting, diarrhea, lethargy. They have swollen eyes. They're forming welts over their bodies or hives. And so in cases like that, and those signs, by the way, are reversible. Of course, your veterinarian will recognize them right away. They usually happen within the same visit or shortly after you leave the office, and we can treat those. Then the question is, what do you do for next time? And so it seems that what I found to work the best, and you guys can chime in, of course, is spreading out the vaccinations. And so instead of giving all 2, 3, 4, 5 vaccines at one time for pets that we know are sensitive to them, you can spread them out. Maybe give 1 vaccination or 2 vaccinations every week until you get the full vaccination protocol completed for that year. And if you're not sure if your pet has a reaction or you're nervous, then nothing wrong with doing that anyway. And that way you can prevent any issues. But especially those dogs that are tinier dogs, then those may be more prone to that kind of issue.
Yeah, and I think you're more likely to see vaccine reactions with your distemper parvo vaccine, the DHPP. We see it a lot with lepto vaccines and rabies vaccines. It's really uncommon with Bordetella, which is usually an intranasal or an oral vaccine nowadays. But it's going to happen usually within the first 4 hours, and depending on the severity, it's an emergency. So you do need to get back to your vet right away. Or if you went to a vaccine clinic at like a pet store or something, you need to get to an actual clinic, not back to the pet store for treatment. And then, usually we'll space out the vaccines. We'll have the owners pre-medicate at home with like Benadryl before each vaccine, just to be safe, because it's a safe medication and it'll help prevent reactions, things like that. Usually, in my experience, we try to figure out by spacing them out the next time which vaccine the pet's sensitive to, so that we can be a little more safe with that particular vaccine.
And the veterinarians will document the record which part of the body received what vaccine. And so if you find like a welt or something in one area of the body, and you can trace it back to what vaccine was given in that location, then you know that your pet's sensitive to that particular vaccine.
Yeah, because I think that makes it a local reaction versus like a systemic reaction. Mm-hmm. And those are still worth noting. We'd still want to pre-med a pet for a local reaction to a vaccine. But with rabies, unfortunately, it doesn't matter what kind of reaction your pet has. Your pet has to have a rabies vaccine by law. So we have to figure out a way to make your pet be able to handle it.
Mm-hmm. Yep. And the other option you have, too, if you don't really want to drive home and realize that your pet's having a reaction, then hang out in the vet hospital for 30 more minutes after your appointment, or hang out in the parking lot and wait a little bit and make sure your pet's okay before going home. And that way you're right there if there's an issue, if there's a reaction or something goes wrong, and they can be treated right away. And then so that's what you can do for pets that are sensitive. Now, what about people that either don't want to vaccinate their pet because they're afraid of autism or something, or those pets that medically speaking, vaccinations may be the trigger for other diseases or may make more diseases rear their ugly heads. And so there are dogs that have immune conditions like joint problems, rheumatoid arthritis type conditions, where vaccinations may be a trigger because of stimulating the immune system. And when the immune system is stimulated and it goes haywire, then other diseases can develop, like joint problems, kidney problems, intestinal issues, liver problems. And so in those dogs, they really can't have vaccinations anymore. Or if you're the type of client that's been vaccinating your 15-year-old dog every year for 15 years, maybe you're thinking, well, enough already. My dog doesn't do anything. He's old. We don't go anywhere. And so is my dog really at risk? Or for those people that just ethically or morally speaking are against vaccinations or want to minimize them, what else you can do? And so one really slick way of getting around this problem, so you're both that you're following the law in terms of rabies vaccine, but also that you don't, medically speaking, put your pet in unnecessary or preventable danger, is you can consider titers. your vet can collect a blood sample and submit the blood sample for vaccination titers and see if the titer in your dog is within protective range. And if you're within protective range, and they do this in people as well to see if you're protected against certain vaccinations or organisms that you would protect against vaccinations, then you are okay to skip those particular vaccinations for that year. And if your dog is subtherapeutic with those titers, then you know that vaccination is actually recommended, and you can actually do it, and you don't feel like you're over vaccinating your pet. And basically every year, instead of spending money on a vaccination that you may or may not need, you can allocate those funds towards vaccination titers instead, and see if your pet needs those vaccinations that year. And so that's a pretty good alternative to vaccinating your dog automatically every year. Now, obviously, we're talking about those dogs that have received vaccinations in the past. This is not the first time puppy or kitten that's never received a vaccination. They're ready for their boosters. That's a different scenario. Those pets should receive their vaccinations, and a conversation with your veterinarian regarding core versus non-core, essential versus non-essential vaccinations are imperative to getting their booster shots taken care of. But beyond the puppy or kittenhood of life, then you can consider doing blood titers every year instead of vaccinations.
Blood titers are, though, only available for certain vaccines, not all of them. So I would say mainly for dogs, you can do titers for the distemper or parvo, but it's not a titer that does every disease or every virus that is part of that vaccine. So you're looking at running multiple titers. And then rabies, of course. So it's also a financial thing, whereas a rabies vaccine and a distemper vaccine may cost you $50 at a really expensive clinic, maybe $5 at a vaccine clinic. Titers are costing you hundreds and hundreds of dollars. So it really should be reserved for pets that do not handle vaccines well, they have reactions, or they have immune-mediated diseases, and vaccines aren't recommended for them. But it's also worth noting there are certain breeds that are predisposed to developing these immune issues following vaccines. I think Weimaraners are one. And they do make special distemper vaccines for those dogs. Is it just Weimaraners, or are there other breeds too?
It was an older study showing based on Weimaraners. We haven't had much as far as studies since then looking at specific breeds, because the condition itself is not that common overall, and so you never know. Like, that kind of study needs to be repeated and just verified.
But if you have a Weimaraner puppy, go somewhere that has the Weimaraner vaccine. Most big hospitals will carry a few of those just for those dogs to be safe. I didn't know if it extended to any other breeds or not. But
that's just based on one study. But as time goes on, we have more studies, and it may end up changing the way we do things with certain breeds. So for those of you out there who have pets that are not dogs or cats, you must be wondering, are there vaccinations for, like, my lizard or tarantula? Jay, we know that you have some of these more exotic pets. Are there vaccinations for these pets? Should people be concerned?
There are no vaccinations for these pets. These pets are a vaccination for me.
Really?
Because they bite you?
Keeps people away.
Hashtag antisocial. Hashtag introvert.
Dr. Ireifej, are there vaccines for ferrets and rabbits and other pocket pets?
You tell me, ladies.
You don't know?
I have no idea.
You're the one that's always like, bring your ferret to me. I'll remove its adrenal gland.
I don't know. You have to go to an exotics pet or veterinarian for that. I have no idea.
I'm sure other pocket pets need vaccines.
Yeah, they probably do.
We're not helpful with that.
No.
Ferrets get rabies vaccine.
I know, but I think they get distemper too.
They do, yeah.
Yeah, okay. But do they get the dog one or the cat one?
Cat.
There's no ferret-specific one then,
No. They all get either dog or cat.
They get cat.
Don't post this. We're dumb.
I had ferrets way too long ago.
No, it's all good. Yeah, so there's obviously in the LA region especially, there's plenty of veterinarians that specialize in pocket pets and exotics, and so these folks will obviously be able to direct you more thoroughly than we can. We're more specialized in dogs and cats, but we do know at least that reptiles and tarantulas don't get vaccines. So
reptiles do need fecal exams, though.
Yes.
Get a fecal for your reptile, not your tarantula. Do you get fecals for your tarantulas?
No, it's like bird poop.
It's so gross.
I'm not eating my tarantula species.
So, are you eating your reptile species?
So just to recap, this episode of Vaccinations, I hope this helped you realize why vaccinations work, how they work with the immune system, what the logic is behind vaccinating animals when they're really young, what to do if your pet is known or suspected to have a hypersensitivity to receiving multiple vaccinations. And then, of course, for those pets that either medically speaking should minimize vaccination exposure, or if you as a pet owner want to minimize giving vaccines to your pet, we hope that this podcast really helped educate you, inform you on some thoughts that we have. Feel free, of course, to add in on the information. As you can tell, of course, we are not the experts on vaccinations, being especially an emergency clinic, but this is a pretty good estimation as far as to at least get the conversation started. And of course, when you see your family veterinarian, follow the recommendations. Their experience matters. They, of course, do this day in and day out with vaccinations. And so they're doing it for the benefit of you, your pet, and pets around you. And it's vital to not only animal health, but also human health. So thank you so much for listening. It's Dr. Shadi Ireifej, board-certified surgeon, chief of specialty, part owner of TrueCare for Pets, Studio City, Los Angeles, California. Thank you so much for Jae and Lindsay.
Bye.
We'll see you guys next time. Take care.